Hi, I'm Manish Koirala, and this is EMK channel. Today, I have called here one energetic nurse, and she is Dawa Lomo Sherpa. She is known as Yangla Sherpa. She is fresh graduate, and she has done her bachelor's here from Nepal Institute of Health Sciences, which is affiliated to Purvanchal University. She has got 3 year experience, teaching experience in CTEVT, and she's currently involved in one uh, NGO that is M4M, that is Me for Myself. It works for mental health hours for Asia Pacific youth. And she is a council member of Youth Congress Nepal, Bagmati province. And she is teaching right now at Lord Buddha Institute. Welcome, Ms. Sherpa, here in this program.
Thank you for introducing me, sir, and thank you very much for having me here in this program today for a wonderful discussion. Looking very forward for
Okay,
it.
thank you. First of all, I'm asking you, why have you
Yes.
chosen a nursing?
This is a very personal, yet this is a very meaningful question as well. I have always wanted to do something very impactful, valuable, and that which is very challenging in my life, which would always create a situation where I'd be learning and I would be teaching people. And I think there is nothing else than nursing that exactly defines what I'm looking for. Nursing is just not a job for me. It's something much more than that. It's a way of expression, way of caring, way of nurturing, and way of being there and being able to be there for people when they need us in the meantime, when they need us the most. And yes, I am here today as a nurse, registered nurse in Nepal, and I am doing what I love and loving what I do. And I think this is the art of living, and I'm loving it.
Okay. And in your opinion, what problems do doctors and nurses face in present situation? As we know, the situation of COVID-19, what do you think regarding this matter? What sort of problems do doctors and nurses face?
Yeah, talking about health professionals and all the frontliner workers, not only about health professionals and nurses in COVID, but everyone is devastated and everyone has um, been mentally very ill or mentally very not healthy in this current situation. Um, Firstly, I would like to thank each and every health professional who have been there every day in a war zone with COVID-19 and working with people and sacrificing their home, sacrificing their time, everything, and they are doing tremendous job. And I would like to congratulate and huge respect I have for them. So yes, I would like to say thank you. But talking about what they face right now is majority of people are dying by COVID, but so is health professionals too. There is not certain data on it, but then like thousands and more doctors and nurses have already been dead due to connection with COVID-19, even though it has not been written in a global form, but it is seen that. And because of that, many people in health professional line, they are having mental health issues. Obviously they would have mental health issues, and they mostly are going in PTSD, which is post traumatic stress disorder. And it is a very sensitive issue, and I think we and the people and the society and government should come up and further help medical professionals in a psychological way, so that they can fight it and fight it back and sacrifice their time and dedicate their time in order to work with COVID-19 patients.
Okay, and at present, you are a health campaigner also. At present, what
Yes, sir.
programs are you people running?
Yes, as I said, I am personally related to with M4M and Youth Congress Nepal, Bagmati province mostly. So we have been further working and studying about plasma donations. So plasma donation might sound a very new thing to people, but let me just keep a short thing over here. Plasma donation is basically transferring the active immunity, the antibodies, which has been uh, already in the people's body from the patients who have already been recovered from COVID-19. So we can use the immunity, the active immunity of the people who have already recovered from COVID-19 to the patients who have been struggling with COVID-19. So is the plasma donation is a very new thing and also a very effective form for the time being until and unless the vaccine is here. I think plasma donation is one of the best method to control COVID-19 and recover the patients. So yeah, we are
Okay,
working for it, and also yeah, also for reproductive health we are working. So
yes,
yes, hoping.
some people say we have found out.
Yes,
People say on
yes,
YouTube that you wearing masks, it will suffocate
yes,
to the people, and sanitizer. This is just
yes,
business of sanitizing and marks production. We should not wear marks, and we should not use sanitizers. Some people are advocating in that manner on YouTube. What do you
yes.
want to speak on this matter?
Um, I would like to say that it's all about the perception, sir. It's all in the perception and how people are taking COVID-19. Are they taking COVID-19 seriously or not? The question starts there because what they are speaking and why they are speaking has a deep root connection with the anger and also the outrageous form of people. And why are they outrageous is the question, first of all. And it's because mainly of the governmental policies and the rules and regulations and all the lockdown and restrictions happening in the society. It is personally causing a lot of damage in the way mask and sanitizers company are working forward for people, because it's the demand of people that created the supply of thing. Everything is related to law of supply and demand, and that's the thing that's happening here. But since COVID-19 is a respiratory disease, we all have to wear masks. We have to follow social distancing in order to be protected and in order to save the health professionals who have been dying because of COVID-19, who could have further saved the life of other people. So we cannot be selfish in this meantime. We have to prioritize that which personal thing we are supposed to do right now. Because
Okay,
if you
okay.
don't wear a mask right now, we might have to go to ventilation system, which is even worst case scenario. So yeah, I think
Okay, okay.
everyone
Now
should
yeah,
prioritize.
I'm
Yeah.
asking certain, personal question regarding nursing. Have you
Yes.
found out mismanagement at health center or hospital? I mean, have you found out that nurses are underpaid? Their services are used more, but they are underpaid. Have you found out this situation even in the big in a hospital? Have you found that?
Yeah. Yes, I would personally not like to indicate certain hospitals or names of them, but in a majority section, I would like to talk about this. This thing about underpayment and lack of respect to nurses, personally, it is an issue, and it has always been a battle to fight with people and people's perception to nursing. um, I would like to say it is an underpaid profession since history. If we look at from history, Nepal has always been here, and they have not prioritized either it's PCL nursing or BSc nursing. How are they getting paid? In what matter they are getting paid? Because in nursing, what is the thing is we work really hard. Nurses work really hard. Doctors work really hard, but neither do we get respect nor do we get a good amount of figures, and that is potentially causing many nurses and doctors to move to abroad and live there, because they are getting the tremendous respect over there. It's one of the respectable positions and respectable jobs in the whole world. But why are we Nepali being so skeptical, and why are we being so not supportive enough in this particular matter is one of my particular concern. So yeah, I hope that this mismanagement, and I hope this underpayment thing will be uh, cleared out in some moment of time, some amount of time. I hope so. Yes.
You told that nurses
Yes.
are underpaid in Nepal and in most of the hospitals. This is I can't say statistically, but I also heard about it. And
Yeah.
you told that
Yes.
most of the nursing students have gone abroad for their bright future. In your case,
Yes.
would you like
Yes.
abroad for higher education?
Yes, affirmative. I'm highly affirmative about it. But first, I have my short-term plans and long-term plans for my life. I don't know how much it is gonna be possible, but then I have my own plans. And according to my plan, I want to work in a hospital as a nurse, as a staff nurse. I want to work and assess my skills, develop my skills in Nepal, being in Nepal, know the system of Nepal and how the system works in Nepal. And after a certain time, I would like to study masters of nursing and also quality management, quality hospital management. And after that, I would like to come back and do some researches in Nepal about management, about mental health of nurses, and the implementation with the patient and quality of care we provide to patients. So yes, I would like to implement my study, come here back and give back to my society. And
Okay,
yes,
okay, and
yes,
in nursing, maybe PhD or bachelor's,
yes,
you people
yes,
studied psychology as well, and you can find here
yes,
remarkable, suicidal case in our country due to COVID-19 or the financial distress. So as
yes.
certain knowledge about psychology, uh, what should be done, to reduce or to mitigate this psychological problem found out in those people who are, financially distressed and who are, mentally distressed due to COVID-19.
Yes, so it's a very serious thing right now. Many people are in anxiety and depression because of the whole COVID-19 situation. But I would like to say that mental health is just not affected from now, but then it has been affected from before. It is a very underinvested sector in our country and in the whole world. And I think in this sector, the whole government and the people and media, everyone should be responsible for it. And mostly youths, I would say mostly youths, because we in Nepal, we have 40% and more of youth. So I want youths to be very active in this manner. I have seen youths very being active in mental health awareness. I have my own friends. I have my juniors and seniors who have been working for it in the youth sector. And I want every youth from every home to be there and work for it, aware for it, because we are educated, our parents might not be. So why not we come up as an individual level? We don't have to do like many things. We don't have to run campaigns of thousands of people. We can just stay home. We can be educated and make our people educated. That's the first step and the very important step. We have to make people educated about what COVID-19 is and what can we personally do to reduce it. So the first thing it be youths. I want every one of you to be educated, and please do not follow any kind of misconceptions about COVID-19, and do not let it spread like a wildfire in the society. Yes, I think
Okay, okay,
this will
great,
help
great.
a lot.
Okay, and what suggestions would you
Yes,
to give to, your line people, means the nurses, as they are
yes,
working, day and night, and they are not caring about their problems. So what suggestion, advices would you like to give young nurses?
young nurses. Yeah, I would like to say that first thing, they being in this faculty and working for it, it has been a tremendous it is a tremendous respect I have for them. And I know, and we all know that nursing is a very challenging sector. And as I told you, it is an emotional roller coaster. It has every day is a new day. Every day you meet with the different people, different patients, different cases. But the thing is, everyone should have this self reflection time and ask ourselves why am I in this profession? Why am I in nursing? Why did I choose this? Why did I choose to be here? Am I doing justice to my profession? So when we do it, when we self reflect on ourselves, then we will get the answers. We will get our answers about me. Yes, I want to do this because I want to do a social work. I want to do this because my grandmom was sick. So I want to help all the other people whose grandmoms are sick. So we all have our reasons. We just have to stay in our grounds and follow what we have to do. And to all the students who have been studying right now in the pandemic, I know things are going hard. Um, and the thing is, always study for yourself. Study to understand and never study for exams. I never studied for exams. I always study. I even study right now, even though my nursing education is finished. I also study right now in every day. That does not make me less competitive. It makes me more knowledgeable, it makes me more skilled, and always just be there as a sister, as a daughter, as a brother, whatever you want to be. But just be with the people emotionally, think rationally, be accountable, be tactful about what you have been doing and what you want to do. And yes, that's it. I hope everybody is very positive about what they are working. And if you have any problem regarding nursing problems, then you can contact me through different social media handles. We will further talk about it and solve it also. Thank you.
Okay, do you, collect statistical data every day, total COVID cases and recovering, or do you collect or not every day?
I personally have stopped doing that, so because it's just a number. Right now, it's just a number. Even though yes, cases have been increasing highly, but it is just a number for me. It is a number for me. Why is it a number for me? Is that it is being a very burning issue, and it has actually caused the uncertainties, stress, and mentally it has been affecting us a lot. So I personally don't look for it exact things, but yes, I think people should be updated, and I personally should be updated on it. It's a very serious thing, and work according to it. Yes.
Okay, sometimes don't you think that I should have chosen other subject, other faculty rather than nursing? Sometimes, do you feel in that manner? Oh, this is my right choice. What do you think sometimes?
Yeah, that's a very tricky question. Yes, obviously, sometimes I might feel, I might have felt that maybe nursing is not for me, but I don't know. I don't remember it nicely. It's a very vivid thing for me. Nursing has always been a passion. Nursing is just not a job for me, as I said. Once a nurse, always a nurse. There is a quote, and I strongly believe that. And yes, I think I was born to be a nurse. I am a nurse right now, and I can't express how happy am I to be a nurse right now and work for people. Even though I'm not working in hospital right now, I am teaching nurses in upcoming generation nurses, and I'm also working in campaigns, volunteering, and I think nothing can make me more happy than this. So yes, I might
Okay.
study other subjects additionally, but I will never change the profession. It's
Okay,
what
all
I
right,
worship,
all right.
this profession.
The last question, positive vibes.
Yes,
Positive vibes
yes.
would you like to give to ordinary people who are watching this program?
um I'm really sorry for the disturbance here.
No, I
um
mean, what positive vibes would you like to give ordinary people who are watching this program right now?
um Yeah, I would like to say everyone to be very sane and prioritize your things. Always prioritize your things. Like right now, we are in COVID situation. We have recently heard about cultural conflicts and all those things happening in our country, and all those enough is enough governmental sections to all the rallies that's happening for our prime minister. So everything, why are we doing it? What are we doing? How our health professionals and health department has been already been sacrificing their life for it, and where we are going, we have to learn it. We have to be responsible and accountable for what we are doing right now. So please prioritize it. Please follow social distancing. Please always wear your mask and be at your home and make your people safe in your home. And if you feel like you are having some mental issues, or you having some mentally, if you feel like like talking to someone, please don't wait for it. Please just do it and talk to people you feel close to, so that they can help you in small to bigger manner. In any ways they can help you. So please ask for help. Please talk to people, because we all know how COVID situation has been going on. But there are going to be more pandemics, there are going to be more outbreaks, but we have to be prepared for it. We have to be always prepared and always have faith on what we are doing. So yes, please be safe, and follow all the guidelines given by government, and please prioritize the need we want right now in our country. Yes, that's the
Okay,
main
okay.
thing.
Miss Yangla Serpa, thank you very much.
Yes.
You gave much more information about a nursing profession, and you gave very positive vibes to ordinary people also. Thank you very much, for joining EMK channel. Thank you very much. You stay safe and happy. Thank you very much.
Thank you, sir. Thank you for having me here.